So the next key theme is advanced IT and analytics capabilities, and this is one of the things that is going to be important moving forward, and here's a number of different technologies. I'll talk about most of these separately. Starting out with the advanced practice management software. So one of the things that I think each practice needs to look at is, what are the software that you have in place right now? How long have you been using it? Not only what is the functionality, does it really have the capabilities, the advanced capabilities that we need now to be successful, but also looking forward into the future. Do we have a vendor who has the wherewithal, the financial stability and the financial capability to develop the additional functionality in the software that we're going to need, ideally to build in some additional things that support the practice, help us become more efficient into the future. Having robust reporting capabilities is very important. It's either embedded in the software itself, what are the inherent reporting capabilities, or what can you layer on top of that? And we'll get to that in a moment with the analytics capabilities. Advanced scheduling capabilities. So not only scheduling multiple resources within the practice, but what about outside of the practice? If the patient needs to have an imaging study before they're seen in your practice, or we need to work with some other care providers to schedule multiple visits at the same time because a patient's traveling from out of town, those types of things. Can the software be an asset and a resource that helps you there, or are you going to have to develop workarounds to get around the weaknesses? Patient eligibility verification. This is something that's real important, something that we really promote with all of our clients that we work with because it's real important to the revenue today, but also moving forward. You want to understand and make sure that you know who is the payer, what is the insurance plan that they're on, are they eligible for it, and do we understand what the benefits are? It's a little bit tricky in that it depends on the clearinghouse that you're using and how robust is the data that they give you back, but it really is a best practice that we want to check the eligibility of each patient who's seen in the office every day, for each of their visits. That's going to be even more important in the future because, again, if I'm being judged on quality outcomes, I need to make sure I understand what's the payer and what are the quality outcomes that I'm being tracked against and making sure that I understand that, for each particular patient. Advanced claims edits and scrubbers, things like coding scrubbers. The whole idea is how can we build in quality? We want to generate clean claims. We want the claim to go out clean so it gets paid. Anything that we can avoid, if there's a missing field, if there's something that's a wrong number, as much as we can build into that, the coding scrubbers with modifiers and so forth, we want it to go out so it gets paid rather than it gets denied or it gets sent back to us and now it hangs out in the accounts receivable until somebody works it. So, what are the scrubbers that the software has that it helps you get out a clean claim? Denials management. A lot of this depends, once again, on the clearinghouse that you're using, but based on the electronic remittance files that we're getting back, ideally we want good data. We want to know what are the denials we're getting them, and what can we do to prevent those denials. So good software systems will be able to report back to you and say, here's the procedures, here's the payers where you're getting the denials, here's the cost, so that you can go back to your staff and say, okay, we need to fix this. We've been getting all of a sudden more of these types of denials, and rather than letting it sit out there and rot in the accounts receivable, let's get it prevented. We want to drive down the percentage of denials that we have. But again, you're basically going to be a hostage to the data that you have, and if you don't have good data, you're not going to be able to make good decisions to try to prevent those denials. Electronic medical records, some of the same thing, and making sure that the EMR system that you're using optimizes the workflow, helps optimize the productivity of the user so that you're as efficient as you can be. Most EMRs do not advertise themselves as enhancing productivity. It's a challenge, but some are worse than others. And so you want to make sure that you understand what is the impact on your productivity, your ability to see patients of your EMR today, and also in the future. You may have seen or heard about ICD-10. That's a whole sea change in diagnosis coding that takes effect October 1st, 2014, where we're going to have a much higher level of specificity on the diagnosis codes as we're going from somewhere less than 10,000 to almost 68,000. So having a electronic medical record that helps you pick, you don't want a big pick list with 68,000 diagnoses on it. They're going to have a good workflow that helps accommodate this for you so that it really doesn't slow you down and slow down your practice. And what are the things that the EMR software is going to be able to do to help you when you develop the clinical pathways? Can you put those workflows into the EMR system, or is there going to have to be some type of a clinical decision support tool that's bolted on? What is the flexibility that the system has, or that the capabilities that are going to be available in their roadmap into the future? How can you decrease the patient-to-patient and provider-to-provider variation? Are there tools, are there reporting capabilities that you can run reports, that you have the fields in the software that you need so that you can generate meaningful data that you can look at and make decisions on? Facilitating care coordination with other providers. So having the ability to talk to other providers, other systems, and so forth is going to be very important. Facilitating patient engagement. I mentioned, what kind of a printout can we give the patient to help them stay engaged with what their care plan is and what they need to do to make sure they're making healthy choices and supporting their care plan. A lot of that depends on your EMR and its capability. What are the patient education sheets it has? What is it able to do with the data that you have in your treatment plan or in your medical decision making that can then be shared with the patient? And once again, robust reporting capabilities. What are the reporting capabilities within the system, and where is the vendor taking it in the future? So it's not only today, but you really want to be thinking ahead, kind of the old chess game, think 3 moves ahead. If this is where the puck is going to be in the future, what is my EMR vendor doing to support me in my practice to be able to be successful with where the dynamics are changing? Clinical decision support tools. Ideally, you want to be able to either pull these into your EMR system or have other clinical decision support tools, things such as patient registries, when patients have certain diseases, perhaps on certain drugs, medical devices, and so forth, but being able to utilize the data that's in patient registries. Incorporating the evidence-based guidelines, payer-defined clinical pathways, and so forth. How do we have tools? You can't remember that. I can't remember Aetna wants this, and Cigna wants that, and UHC wants something else. It has to be driven by prompts and by support that you have in the software and for your care team, so that it's not people remembering things or we have a bunch of hard copy sheets floating around. If we're using our IT capabilities to its fullest potential, we want our IT either as a separate clinical decision support tool that bolts on to our EMR or embedded in our EMR to support us on that, to provide the high quality care and to adhere to the clinical pathways that we intend to follow. Financial and clinical analytics. So they're by provider, by practice, by payer. On the clinical side, if we have these quality metrics, we want to be able to track them. And so we need the analytical capabilities to do that. If it's not within our software, our practice management or EMR software, we need to have another analytics tool that we can bolt on and extract the data and give us this meaningful information back out of it. Same thing on the practice management side. Making sure that we have the information that we need to understand where are the payments coming from, why are they, if we think we're being underpaid by certain payers and so forth, what analytics do we have that helps show us that, where is it coming from, and how do we fix it? Being able to track these incentive payments and then link when I have a quality payment to the financial payment that I'm receiving. That's going to be fairly complex, so you're going to need to have good capabilities within a software solution that helps provide that information for you. Ideally, what we'd like to be able to understand at some point is cost. Cost on the work relative value units, so the work RVUs. Ideally, we want to know where are we making money and where are we not making money. On certain patients, on certain payers, on certain diseases. That information can be important, that if we understand our payment really is not high enough based on the revenue we're getting per RVU for this patient or for this clinical condition and the amount of work that we're having to invest, we're either going to have to figure out how we can provide that care more cost effectively so it can be profitable for us, or we're going to have to figure out how can we get more revenue or generate better payment so that it can be profitable for us. Predictive analytics are very important on both the clinical side as well as on the financial side. So on the clinical side, we want to predict, when we know what are the risk stratification of our patient population, now can we predict who's at the highest risk for readmission to the hospital? Who's at high risk for high resource utilization? What are some of the things that we can do to try to aggressively manage that proactively up front to prevent them from having that acute asthma exacerbation or whatever it might be? What are the things that we can do to really make sure we're managing our patient population and our chronic conditions as carefully as possible by identifying who has the highest risk and how can we then plug that into clinical pathways and protocols? On the financial side, one of the things that is important as well is being able to look ahead and do, in a sense, what-if scenarios. So one of the examples I like to use, and it's something that we've done with our clients, is those no-show patients. No-show patients are an important cost to the practice. Each patient slot where you can be seeing a patient is valuable. And so if somebody doesn't show up and another patient is not being seen, that slot could be used for a paying patient and could be generating revenue. So if on average, let's say for an established patient, our practice makes $100 per average established patient, and we have 50 no-shows, on average every month, there's $5,000. So be able to make that extrapolation and say, I've got $5,000 of cost in no-shows each month. Now you can start making decisions. Maybe I should start sending out postcards, or maybe we can try that, or maybe we do some callbacks. Or are there any similarities between the patients that aren't showing? Is it certain diseases or certain days of the weeks or certain reasons that we can identify that we can decrease those no-shows? Because our idea is we want to drive it down. I know some practices that charge for no-shows, create a disincentive to the patient. So it's not that one thing is right or wrong, but there are different options that you can use. And if you can cut those no-shows by 50%, that's an additional $2,500, per month if you put a paying patient in there, on average, $30,000, per year to the practice for the same cost. So, that goes right to the bottom line. But those are the types of things that ideally you can start working on with your practice manager and staff, or with a resource, like PPN, to help give you access to that type of infrastructure. Patient engagement solutions, making sure that you can provide the feedback. There's personal health records, patient portals, different tools. We've talked about patient registries, wellness software, a number of different things. I'm seeing a lot in mobile applications. Talked to a couple of different companies. One company is actually developing a mobile application, so for your smartphone, for diabetics. And it's all about, so every time they can go out to a restaurant, they can understand, okay, for this meal, if I want to get that, what are the calories, what are the trade-offs and so forth. They can follow data serially so they can see their own data points, helps them to make healthy choices. Talked to a guy who started up another company just a couple of weeks ago who has Crohn's disease. And he happens to be an IT software guy, and so he wrote a program for his smartphone for patients with inflammatory bowel disease, about resources of information, tracking, daily information to really try to help that patient become better engaged in managing their care. And now he's looking to expand it out into other diseases. So these mobile solutions are really going to be an important component and asset in the future. And so once again, you want to be thinking about how can we utilize those as part of our patient engagement strategy.